So now we are discussing about the foot imprinter Harris mat. So we have a model called FM1111, which is being supplied in India exclusively by us. So this is the bag which has all the components inside, easy to carry, and this comes with a padded foam inside, makes the unit very rugged, solid. Now we will see the content. You will have the Harris mat, the foot imprinter, and then we will have about 100 sheets of recording paper that we will again see, and we will also have the complete accessories which contains the ink pad and then the ink bottle, rubber roller, everything. So this is the kit content. It contains the foot imprinter ink, which is in black color. It comes about 60 ml. So this is one of the accessory, and then you have a rubber roller for transferring the ink from the pad to the mat. This is another accessory, and you will also have a foot imprinter ink pad, specially made for this particular product. So this is the complete kit supplied with the foot imprinter. So basically the first one is the Harris mat, which is fixed within the blue color box, plastic box, with all the instructions. The mat gives you the imprint, and then the ink roller that helps you to transfer the ink from the ink pad to the mat. Then ink pad. This particular ink pad is specially made for our foot imprinter. So the ink inside is used for taking the imprint, and we also supply about 60 ml of foot imprinter ink, special ink made for our foot imprinter. So you can use that ink in the pad whenever the pad gets dried, and then you can use it. And the last one is the prescription pad or recording paper. We give about 100 sheets. So later on, if you want, you can buy from us, or you can make your own design. Only thing is the paper should be thick enough, and then it should not, the ink should not spread than the applied area. That's the only criteria. This is our foot imprinter Harris mat model FM1111. So this has got a special mat. It is made exclusively and it is being imported, and all the instructions, the unit serial number, catalog number, manufacturing date, cautions, contact address, instructions for use, and also the cleaning method are described here. And this is the Harris mat. You can see the top portion of the Harris mat is smooth, and if you see the inner side, this has got checked pattern. You can see now. You can see the checked pattern. They're rough. There are squares and plus inside. This is where we apply the ink, and then we get the picture. We can do both static measurements and also dynamic measurement. Static means just standing on the mat. That will not give you the exact pressure, whereas dynamic, which is the walking, will give you more information about the pressures. While using the foot imprinter, we need to have few cautions. the foot imprinter has to be kept on a plain surface. It should not be very smooth, otherwise when they walk probably it might slip and move and injure the patient. So place the Harris mat in a place where it is more stable. This is our foot imprinter recording paper or prescription paper, whatever way you may call it. So we normally supply along with the instrument about 100 sheets. There is nothing special in this sheet. Only thing is it has to be thick and the ink should not spread. And this has got two sides. One is with some measurement, the other side is a plain. On this measurement you have the patient details. You can enter the patient details like the name, age, sex and all, and then some physical examinations can also be done. Like you can also note down whether about the previous ulcers, amputations, skin color and all those information. And in the bottom you also have some measurements. In case if you have some facility for making footwear, then these measurements are very useful. So they are self-explanatory. You can see these numbers, and then that means you have to measure the length of the foot after you draw it, and then the breadth, and then the circumferences. And you have to ask the patient to keep the foot and then draw the outline. So with that outline you can able to find out the length and then the breadth. So this is one side, and the other side is a plain paper. So but that is used for Harris mat, for taking the printout on the Harris mat. Now we are using the roller. Just roll it on the ink pad repeatedly. The ink from the pad will get transferred to the rubber roller. Press it evenly. Rotate it in such a way that the ink gets transferred. Now you can see the ink is there on the rubber roller. Now it will be applied onto the Harris mat. And now here this is the gridded surface. Now is applying the ink. Roll it evenly. You can see now the ink gets transferred. You can see the black color. Evenly roll it on all sides. Do not press it. Gently roll it so that ink from the roller gets transferred to the pad. Now the pad is ready for use. Now we need to fill in the patient details before the patient moving on the mat. We should make sure that patient wipes out his foot on a mat so that any tiny particles which is embedded on the foot will be removed. So when he walks on the mat, it will not create any damage. Now the patient's now wiping it on the mat. Okay, then now the measurements are being made. You have to make the pen vertical and then just draw the outline. Now outline is measured. The length can be measured now with a tape. It is, how much it is? 225, 250 millimeter. 247, okay. It is written on that. It is how much? 90, 95? 95 millimeter. Now the circumference at the metatarsal head area is being then dorsum area. All these measurements are very useful because sometimes patient may have an edema. So with the edema, if the footwear size is not properly measured, then the footwear what is supplied by the supplier will be very tight for the patient. After all the measurements, now ready for imprint. Turn the paper. Now this is a plain side which is kept, and then the mat is closed, so the ink side will go to the bottom of that. Now the patient will walk on top of the mat. Yes, he can do normal walking. Now because of his walking style and then the weight, the ink get transferred onto the paper. Now when you lift it, you will see nice imprint is done on the, you can see it's a clear print. It gives you a normal, this is a normal arch patient report. The same way, one more time ink is applied because the ink gets transferred, so the same way apply. Then now the other foot will be taken. Just for demonstration purpose, now I am taking from a different patient who is just to see the arch type. Now the paper is kept, then the mat is closed, so now he will be walking on top of the mat. So let's see the pattern. It's a flat foot. You can see complete arch is, the complete foot is making contact. So the entire foot is making contact. So now you can see very clearly two different image from two different patients. One which is here is normal arch, you can see the shape, whereas the other one, it's a flat foot. It gives very fine information. If you look at this, so this particular person is putting pressure on the toes and all the toes, and you can see here there is less contact. The rest of the area is normal, but only in the toe and part of metatarsal head he is putting high pressure. The use of this particular product is if the patient is diabetic, especially their neuropathy and their biothesiometry score is more than 25 volt, since they would have lost the sense, since they are already lost the sense, so they will not feel the pain. They are likely to get ulcer in these high pressure areas. With this we can educate the patient to go for a better footwear, and if we have a footwear supplier, then with this print and then the measurements, the footwear supplier can make a special footwear for the individual patients. The images indicated in the screen are with flat foot, normal arch and high arch. Flat foot, the whole foot is making contact, whereas in high arch the center portion, instep area is not making contact. So this is the advantage of this Harris mat. Thank you for watching this video. We have provided all the information possible. Should you need any assistance or any service related issues, please do contact us. The phone numbers and the email IDs indicated on this page. Thank you once again.